Welcome back. Breaking news just in. The Prime Minister will host a press conference tomorrow, setting out the final step of the roadmap out of lockdown. The Health Secretary, Sajid Javid, will announce the plans to Parliament. We're not sure whether before or afterwards, I presume beforehand. Now, Downing Street has confirmed this evening that Step 4 is expected to begin on Monday, the 19th of July, if the government's 4 tests for easing COVID restrictions have been met. This will be confirmed on the 12th of July following a review of the latest data. But tomorrow, the PM is expected to outline the next steps on the 1 metre plus rule, face coverings and working from home. An update is also expected on the next steps for care home visits. In a just-released statement, Boris Johnson has said, thanks to the successful rollout of our vaccination programme, we are progressing cautiously through our roadmap. Today, we will set out how we can restore people's freedoms when we reach Step 4. But I must stress that the pandemic is not over and that cases will continue to rise over the coming weeks. As we begin to learn to live with the virus, we must all continue to carefully manage the risks from COVID and exercise judgment when going about our lives. My panel back with me now, Dominique Samuels, Richard Power-Said, but let me go first to Tom Harwood, our political correspondent. Tom, what does this all mean? Big announcements tomorrow.
Absolutely. After a long time of speculation, we're finally going to hear specifics. We saw a lot of briefing in today's Sunday papers, but we will hear from the horse's mouth tomorrow from the Prime Minister exactly what will be restored, what liberties will be granted back to the English people, I should say, because, of course, in Wales, in Northern Ireland, in Scotland, the Freedom Day is different. But for 82% of the British population, those that live in England, this will be a significant set of liberation, this Step 4 measure. But of course, this is only if those 4 tests are met. And I think it's worth reminding ourselves what those 4 tests that the Prime Minister has always set out are, because they weren't met last time on Freedom Day. Now, the first is that the vaccine rollout continues successfully. There's nothing that we've seen that looks like it will change that. The vaccine rollout is continuing successfully. The second one is that the vaccines are effective against the virus. We know they are. They're incredibly effective against the virus. 92 and 96% against hospitalizations, even against the Delta Indian variant. Number 3 is that an infection risks hospital overload. So number 3 is that hospitals aren't at risk of being overloaded by a wave of infection. Now, this is the one that was ambiguous last time, but it does look like that link between cases and hospitalizations are more broken now. And the 4th check is that the risk has not been changed by a new variant. Well, no new variant has been announced as of yet, so it looks like that will be met as well. It looks overwhelmingly likely that all 4 of those checks will be met, and the Prime Minister will announce a substantial unlocking, a substantial return to normality on the 19th.
Dominique Samuels, key line here from Downing Street. The Prime Minister is expected to reiterate that COVID will become a virus that we learn to live with, as we already do with flu. This means that hospitalisation, serious illnesses and deaths from COVID will continue, albeit at a much lower level than before the vaccination programme. Finally, Dominique, it feels like the government is learning that we have to change the messaging around COVID, which I know is something that you and I have been saying for weeks.
Yes, even just before, when we were talking about the messaging is extremely important because of the campaign that the government has pushed forward in terms of advertising. Even when restrictions are lifted, a sizable portion of people will be too scared to go out and participate in normal life. And what I've been saying is I think there needs to be more of a comprehensive messaging, as there was last time, to inform people that, yes, it is safe to go outside. We will have to live with COVID. And as you know, you have risks in everyday life, there will be continued risk to COVID. I think that the announcement is very positive, but I think that the Prime Minister's announcement is sort of a balancing act in a way. I think that there may be some restrictions that still remain in place, I think, for bubbles and travelling and things like that. But I think there will be significant things lifted, for example, mask wearing in shops.
Richard Power-Said, what's very interesting about this to me is the Prime Minister's going early this time. He's not waiting. So while he's officially going to announce a full unlocking on the 12th, this comes a whole week ahead of it. It feels like the government wants to do a lot to lay the groundwork, to prepare people, maybe to make people feel confident.
I mean, well, let's hope that's the motivation behind it. I do worry that a lot of what we've heard coming out of the government in the last 48 hours, I mean, including that piece from Sajid Javid that you mentioned earlier, I do worry that a lot of it is much less to do with dealing with the pandemic in a responsible way, talking to the public in a sensible way, and rather it's about internal party management within the Conservative Party. You know, Sajid Javid's a very ambitious man and he wants to be better liked by the Conservative backbench than his predecessor Matt Hancock was. The Prime Minister has to worry about his popularity within the party as well. I think they're more concerned about how, the hawkish Tory MPs who have been very upset with their behaviour in the last few months, more concerned about pleasing them than doing anything else. I think we have to remember that whilst lots of people, both hawks and doves on the, in terms of pandemic policy, lots of people talk with a lot of certainty about what's happening right now, what's going to happen in the next few months, how changing this policy or that policy will impact on the spread of the virus and the potential for new variants to emerge, things like that. This is an experiment. No one knows what's going to happen in the coming weeks and months. The whole world is looking at Britain to see, OK, well, if you've got that many people vaccinated, not everybody by any stretch of the imagination, and you've got this kind of Delta variant coming in which is able to get around the vaccine sometimes, can you cope with it? No one knows if we're going to be able to. This is an experiment. Hopefully it's going to work out well.